Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Reform Advocacy. We address problems in the healthcare system, take actions, and try to make the system work better for all of us. Today I want to talk about insurance companies and cheating. I am shocked to find that insurance companies are cheating. Apologies to Casablanca, and thanks to Angela for pointing out this story. The headline is that Cigna will be paying $172 million to settle a U.S. government fraud lawsuit. Cigna will pay $172,294,350 to the U.S. government because they violated the False Claims Act by submitting and failing to withdraw inaccurate and untruthful diagnosis codes for its Medicare Advantage plan enrollees in order to increase payments from Medicare. They are the latest to settle this problem. Of course, Cigna's not alone. 4 of the 5 largest Medicare disadvantage players, UnitedHealth, Humana, Elevance, and Kaiser, face federal lawsuits alleging that efforts to overdiagnose their patients crossed the line into fraud. We've mentioned in the past how Medicare Advantage works, and so I want to do that again. Medicare Advantage is not Medicare. Don't confuse it. It is private insurance. When you sign up with one of these private companies, they are paid a monthly fee for having you as a subscriber. They may be taking premiums for you and you're still paying money to Medicare every month, but they get a minimum of $1,000 a month for everybody that signs up. And if you're sicker than normal or sicker than nominal, like not sick, if you're sick a little bit, they can get more than that $1,000 a month. And that's what the government is charging them with. They put people into that sick category who didn't belong there. Cigna went and reviewed all the diagnoses for all their Medicare Advantage plan subscribers for 5 years, 2014 to 2019, and they increased the severity of diagnosis so they could increase those payments. A link to the story is going to be in the text for this article in the description, and the text will be in our daily newsletter, Healthcare Advocacy. The New York Times studied this last year, and what they found is that most large insurers in the Medicaid Advantage program have been accused of fraud. Here's how it works. The most common allegation is that the insurers did not correct, potentially invalid diagnoses after becoming aware of them. That's really giving them the benefit of the doubt that some of those diagnoses weren't juiced up at the beginning. Anyway, it turns out that it's worth tens and tens of millions of dollars to these companies. There was one example that Aetna found that if they had to pay back all of their juiced up Medicare Advantage claims in 2017, the value they would have to forfeit would be $86 million. I think that one is still under discussion. Okay, so people try to cheat the government. The good news is that the government finds them and gets the money back. Now, they can also send people to prison. There's a Department of Justice website that I've put into the text, and you can view tons of these cases if you want. Now, let me tell you something. The reason this is important is when somebody cheats an insurance company, they don't always go after it. What they do is they just increase premiums, and they get away with it. And that's not a small thing. When someone cheats the government gets to send you to prison. That's a good thing. And you know, a lot of people complain about fraud and what's going to happen with universal health care. Well, it turns out that the fraud levels in the public programs like Medicare are far lower than they are in the private programs. So that's a good news. The other thing is that having the government have the force of law makes just all the difference in the world when it comes to fraud. Okay, now let me tell you something. This is not new. The dishonorable senator and ex-governor of Florida, Rick Scott, you've seen him on the news, I'm sure, oversaw the largest Medicare-Medicaid fraud on record at the time. This was in the late 90s, early 2000s. His company, HCA, was forced to pay the government $1.7 billion in the early 2000s. There will be a link to it in the text. You can go and find it, or look him up on Wikipedia. It's on his Wikipedia page. His company also cheated Medicaid in Florida and had to pony up another $631 million, and the state of Florida wanted $17 million. All told, for cheating Medicare and Medicaid cost that company $2.3 billion. He got fired and then wound up as governor and senator. Now listen, when you see that guy on TV yammering about honest government, keep this story in mind. Okay, let's have some happier news. Reducing the spread of sexually transmitted diseases. Okay, now listen closely. Safe sex, safe sex, safe sex. Okay, we've said it. Now, if there is a mistake, it turns out there's help. U.S. health officials are planning to endorse a common antibiotic as a morning after pill that can be used to try to avoid some increasingly common sexually transmitted diseases. The proposed CDC guideline was released on Monday, October 2nd, and officials are going to move to finalize it after a 45-day public comment period. With STD rates rising to record levels, more tools are desperately needed, said Dr. Jonathan Merman of the CDC. The proposal comes after studies found that some people who took the antibiotic doxycycline, that's a rather old antibiotic, within 3 days of unprotected sex were far less likely to get chlamydia, syphilis, or gonorrhea compared with people who did not take those pills. Okay, here's an extra credit action. In the text, and I'll put it also in the description, I'll put the link to the CDC webpage where this document is present, and you can comment there. There's a little comment button. You just click on comment, and you can let them know what you think about it. I did. I told them I'm glad somebody's investigating a way to reduce the spread of disease. You could do that. Okay, make sure you like, share, put in comments in the comment field, subscribe to Healthcare Advocacy, and we'll see you next time.